Good morning or afternoon, healthcare science students. So as you can see, I am not here today in class. I will have Zoom up, but I'm only going to use Zoom to take attendance. My daughter is not feeling well, so I'm going to be home with her, and I highly doubt that I will be able to teach while also taking care of her. So instead, I'm going to put you guys a video lesson so that way you will know exactly what to do. So I'm going to show you guys how to get to the module today. It's going to be on the 7th grade healthcare science page. But my 8th graders, your page looks almost exactly the same, so you don't have to worry about that. We're going to go over kind of what I would have taught you guys in class and then the directions for what you will be working on after that. So let me go ahead and pull this down. Today, to start, you guys will watch this video, so you don't necessarily have to see the notes, but I'm going to pull up the notes anyway. And we're going to kind of talk through them. So we're going to be talking about medical terminology. And if you've been in this class before, we've already probably discussed medical terminology. However, it's super important to cover every single year because as we move forward, we will be starting to talk about a lot of medical terminology. So, medical terminology are the words that doctors and nurses and physical therapists and anybody in the healthcare field will use when they're talking about any type of disease or pretty much anything medically related. They don't use what we call layman's terms. So layman's terms are what we would use. So instead of saying heart attack, which is what we would use as layman's terms, they would say something like myocardial infarction. Instead of saying like a mini stroke, like what we would use. So a stroke is when you have a blood clot that goes into your brain and it causes blood flow to not flow to a certain area of your brain. We might call that a mini stroke. They would call it a trans-ischemic attack. So the thing is, typically doctors in the medical field, or really any healthcare professional, they're going to use medical terminology, which may be confusing. So we're essentially going to be learning a whole nother language. In learning medical terminology, you guys are going to learn how doctors and nurses in any medical profession describe the human body and things going on with the human body. Now, we've talked a little bit about medical terminology when we talked about infection control, because we talked about epidemiology. Ology, meaning the study of something, and epidemi, meaning among the people. So we talked about how epidemiology is the study of how a disease spreads among the people. And you can pretty much figure out what a doctor does based on their title if you know how to translate it. So we said that a heart doctor is actually not called a heart doctor in medical terms. They're a cardiologist. A doctor that would look at your brain and nerves, you wouldn't call them a brain or nerves doctor, you'd call them a neurologist. Somebody who looks at your teeth or cleans them would be called a dentist. Somebody who straightens your teeth would be called an orthodontist. A doctor that specifically works with children would be a pediatrician. And we're going to talk about the origins of those words and how we use them in the medical field. So I'm sure you guys have talked about this in ELA, the basic elements of a medical word. So there's a word root, a combining form, a suffix, and a prefix. These are all terms you have heard and learned about before. A suffix goes before the word, a suffix goes after the word root, and a prefix goes before. The combining form is just there to help it flow. So to give you an example, the word root is the main part or the foundation of the word. Typically, in medical terminology, the word root refers to a body part, and a majority of the word roots are derived from Latin or Greek language, which is why it's like learning a whole nother language. So here's an example. Dent means tooth, which is why somebody who is a dentist, ist meaning a specialist, they specialize in the tooth. Dermat, or dermatologist, would be one who studies the skin. Cardi means heart. So if you are a cardiologist, you are one who studies the heart. Gastra means stomach. So somebody who is studying the stomach would be a gastrologist. And pancreat, so if you've ever heard of pancreatitis, which is an inflammation of the pancreas, pancreat would mean pancreas. So, combining forms make it easier for the word to be pronounced. So instead of a cardiologist, we technically could make it cardiologist, but that doesn't really flow that well. So instead of that, we put in an O or another vowel. The vowel will help the word flow. Most commonly, it's going to be an O or an A, and it's typically a vowel. So the combining vowel is typically an O, but it can be others. So for example, we have gastro. However, if you've ever watched my 600-pound life or my 500-pound life on TLC, you've heard of a procedure called a gastric bypass. Gastric, the combining form would be an I, which is a vowel. But a gastric bypass is when we have a patient who would like to make their stomach smaller so then they would consume less food and hopefully lose weight. If you guys have never watched that before, it's a very interesting show. Okay? So, you can see here they show gastro is the word root and O is the combining form. Now, there can be more than one word root used in a medical term. So, for example, we have osteoarthritis. This is a condition that causes an inflammation of the bones and the joint. Now, with that being said, itis is the suffix, meaning inflammation of. Arth means joint. Joint is the term that we use where two or more bones meet. So you've got an ankle joint, a knee joint, a shoulder joint, and, elbow joint. All of those areas are where two or more bones meet. Osteo means bone. So when you break it down, it's got two word roots, osteo and arth. The combining form is the O. Even though arthritis starts with an A, it'd be really difficult to say osteoarthritis. I can't even say it. So they put the O there, so it's osteoarthritis. And the suffix is inflammation of. And we just use these slashes to make them into separate elements. Okay? So, by knowing how the medical words are built, it's easier to understand how they are put together and then what those words mean. So, for example, we're going to look at this condition, leukocytopenia. So, leuko means white. Cyte would mean cell. So, what are we talking about here? Obviously, we're talking about white blood cells. And penia would mean deficiency. Now, the O is just the combining form, so with this condition, this person would have a decreased number of white blood cells, otherwise known as leukocytopenia. Suffixes. So these are what are going to be at the end of the word. It can modify the meaning. So we can see here, it's giving an example of the combining form which can be used. So derma, which is actually the word root, means skin, sclero meaning hardening. The O combines those together, so it's easier to pronounce scleroderma. Okay, so here are the meanings of certain suffixes. AL meaning pertaining to, so dental meaning pertaining to the teeth. ER means one who, so speaker would be one who speaks. Able meaning capable of, and they have playable, so it's capable of being played. There are some in the medical field that are not as easy to pronounce. So we've got oma, which means tumor. So you can see that means hematoma. And hema is the word root. That means blood. Oma means tumor. So hemat means blood. Oma means tumor. So obviously that translates to mean blood tumor.
Teachers, if you will please release all 8th grade NJHS.
All right, so that's nobody in here. Sorry, we're doing the announcements for the pictures. We've also got these suffixes, meaning scope, and it means an instrument to view. So if you've ever heard of anybody having an endoscopic surgery, that means they're having a surgery where they use a camera to be able to see everything. Obviously, I know you guys have heard this one before, rhea. So diarrhea. I mean, if you've ever had diarrhea, you definitely know that there is some flow or discharge to it. If you have nasal drainage, that's called rhinorrhea. And rhino meaning nose, hence why a rhinoceros is named a rhinoceros. Rhea meaning flow or discharge. We've got algia, which means pain, edema, which means swelling, and ura, which means to urine or urinate. So if you ever drink coffee, that's a diuretic. A lot of people think that coffee will make you poop. Coffee actually makes you pee. So a diuretic will get you going. All right, so just to review, the combining form just puts the word root with either another root or a suffix to make it easier to sound. A combining vowel is not used before a suffix that begins with a vowel. Prefixes are placed before, so here are some examples. We've got hyper, pre, post, and hypo, meaning under. So hyper means excessive, hypo means under. So if you ever heard of anybody with, I keep going back to the wrong idea of hypo and hyper. Hyperglycemic index means excessive glycemic. Anyway, I'll come back to those. But you have somebody who's preoperative, they're called pre-op. That means before the surgery. Postoperative or post-op would mean after surgery. So if you have a pre-op patient, they haven't had surgery. Post-op, they have. All right, so here's another example. Hypoinsulinema. We've got the prefix, the word root, and the suffix. And that would essentially mean low insulin in the blood. Okay? All right, so now that we're done with that, I'm going to give two sets of directions. One for my in-person folks and one for my out-of-person folks. So, if you are in person, you are going to get this packet. I highly suggest that you do not lose this packet because if you lose this packet, you're responsible for printing another one. This packet is going to be 80 points, I believe. So I would highly suggest that you do not lose it. Okay, do not lose this packet. What I want you to do is put your name on each one of the pages, and typically there will be a spot for your name. Wherever you see name, write your name on that thing. The easiest thing for you to do is to actually rip the top page, okay, rip the top page off of the packet, which is why it's super important you put your name on it. And of course, I just dropped it on the ground. So, you've got your packet, and you've got this right here. Now, everything is going to look backwards because it's mirrored, and I haven't changed that setting on my MacBook. So anyway, on one page, so where it has two big columns, you've got the prefixes and the suffixes. So just know that the only thing you will find on this are prefixes and suffixes. The word root is on the back. Okay, so if you're looking for word roots, it's going to be this page. If you're looking for suffixes or prefixes, it's going to be this page. Either way you look at it, they're going to be pretty much the same. So they're going to be arranged alphabetically by the suffix or prefix or the word root. So the very first thing you're going to work on is this word root quiz. So the very first one is muscle. So to get started, I would need to find which side of the paper I need to use. Is it going to be the prefixes and suffixes, or is it going to be the word roots? Hint, it's the word roots. So, I've got my word roots here. The very first one that I'm supposed to look for is muscle. If I look down these categories, on the left-hand side of each column, so this part here, and again, I'm so sorry it's mirrored, but you guys can figure it out. These are the Latin roots. So if I look for muscle on the left-hand column, I'm not going to find it. I would need to look on the right-hand column. So if I look down here, boop, 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 here it is, muscle. Okay, so muscle means myo. So I would write down MYO on the muscle column, and then I just work my way through. You're going to have a word root quiz. Then you will have a prefix quiz, which you would need to use the prefixes side. And you will have a suffix quiz, which you will use the suffixes side. You probably will tear through that pretty quickly because it's not that hard. The next page is a little bit more difficult. Okay, this is medical terminology identification. They have an example for number 1 already shown. So it shows cardi/ology. Cardio meaning heart, ology meaning the study of. What you would have to do is you would need to go through all of these and find the word root. So for example, the second one, the word root is cardi. Now this is what makes it so difficult. Pericarditis. Okay, so if I put the slashes, peri/cardi/itis. Itis is a suffix, but it has a shared I with cardi. So if you're looking and you're trying to find it, it's going to be difficult, but try to go through these. So like cyanosis, cyan would be the word root, osis would be the suffix. So you go through these and you try to define them. So peri means around. Cardi, we know, means heart. And itis means inflammation of. So on your sheet, you would have something that looks like this. You'd have the dissected word, and then you'd have what it means. Peri means around, cardi means heart, itis means inflammation of. Next up, you're going to try to find the word root in these ones, and then you would match it with the description on this side. They can match multiple times. Okay, so that's pretty much as far as I would like for you to get into the packet. Just those first 5 pages. The last page, I feel like we will need to do that together as a class. So if you want to try to jump ahead, you can. But just FYI, that's what that's for. Now, if you are in class, you can stop watching this video because you already have your directions. You're good to go. If you are virtual, I'm glad that you watched that first part because it's going to pertain to you the exact same way. The only thing that's going to change is that you guys are going to submit your assignment on Kami. So this is for my in-person folks. If they have to print off another form, they can find it here. You guys are going to medical terminology packet, okay? Now I'm going to click student view so I can show you what yours looks like. Unfortunately, because you guys cannot print off anything, or I can't print stuff off and give it to you, you guys are going to be using Kami to turn in your work, okay? Now that means I cannot rip off that front page. So just know that page number 1 are your prefixes and suffixes, and page number 2 are your word roots. So as I start through here, and unfortunately it's going to be a lot of scrolling up and down. There's really nothing I can do about that. But here to insert what it would mean, you have to choose the text box, okay? You would click the text box here. Okay, click here and you would type in myo. So then I would have to look up bone marrow. So I'd come back up to the word roots. I would look for bone marrow, okay? And then, oops, look, there it is right there. So it's myelo. So then I would add in myelo. Boom. And you will continue doing this for the word root quiz and for the prefix quiz. It will be harder for you to add in a text box for this. So for this part, I would almost suggest using drawing. So that way you could draw in your lines. If I wanted to do pericarditis, I could do it that way. Or if I wanted to do cyanosis, I could do it that way. Alrighty. Now again, this is going to be worth 80 points. So if you guys are virtual, you should have watched this entire video. If you guys are in person, I mean, obviously you can watch the entire video too. But anyway, that is what your assignment will be for today. If you have any questions, you can email me. You can notify me on Canvas. I intend on being online for attendance only. And right after that, I do expect for you guys to go ahead and get this started. Alrighty? So that is your assignment for the day. You guys can go ahead and get started. I'll put this right in the front. I will be Zooming, but just for attendance. I will not be giving the lesson. Watching this video is the lesson. If you guys are like, this is a very long video and I don't want to watch it, too bad. That's exactly what you're doing. All right, guys, have a great day. I'll see you when I get back.